Thank you for joining us today. I think I know many of you on the screen, but in case you're attending a LERA program for the first time, my name is Gail Winchin, and I'm the president of the Connecticut Valley Labor and Employment Relations Association. Before we get started, just a few updates. First of all, I want to thank everyone who has served as a presenter or attended our programs this year. Whether a testament to the convenience of Zoom or the outstanding quality of our programs or both, we had record attendance at the 6 programs we offered this year. I also want to thank our steering committee members who helped to plan our programs. Our committee is comprised of representatives of management, labor, and neutrals. And it is really a terrific example of how people on different sides of often controversial issues can collaborate to solve problems and serve the community. I often tell people that if our governmental bodies worked as well as our steering committee, we'd be in a much better place. And finally, a word about next year. You will be able to renew your membership or join and become a member through our website, just like we did this year. And our steering committee will be meeting in a couple of weeks to discuss our program topics for next year, and also to talk about how and when we will meet. I know many of us are eager to start resuming in-person programs, and many people still like the convenience of a Zoom webinar during lunchtime, so we will keep you posted. And so on to our housekeeping details for today. Everyone is muted to preserve sound quality. The program will run about 45 minutes. If you have a question that is specific to what the presenters are talking about, throw it in the chat and I'll politely interrupt them, but otherwise we will take questions at the end. You could either raise your virtual hand or again, put a question in the chat and we'll get to your question for sure. The presentation is being recorded and will be available on the LERA website. We will also make the slides available to attendees, and you will receive a CLE certificate. And for those of you who are calling in from your phone or have some other name on your iPad or computer, just make sure that you rename yourself so that we can get your CLE certificate in your hands. Because if it's a phone number, we don't know what that phone number is attached, the person to whom that phone number is attached. So at this point in time, I'm going to turn it over to our presenters, Justin Zartman of the Connecticut Education Association and Keegan Jornowski from Shipman and Goodwin. So Justin, Keegan, take it away.
Great, thank you. Keegan, do you want to introduce yourself first?
Sure. Thank you so much for having me today. My name is Keegan Jornowski. I'm an attorney in the Employment Defense and Labor Relations Group at Shipman and Goodwin here in Connecticut, and I'm based in our Stamford office. So looking forward to having a discussion with you today about issues that I've been dealing with on a daily basis as, dealing with clients who are employers and schools, just trying to navigate this changing landscape.
And I'm Justin Zartman. I'm a UniServ director with the Connecticut Education Association. And I actually volunteered to do this presentation through LERA since I'm on the steering committee. And I had watched one of Keegan's presentations. So I called her and said, hey, would you help me with this? Let's do this together. And she's been great. So this is through this program, this has been our first meeting. And it's been great to work with her. Try to move this ahead. Okay, so today's presentation is a shot in the arm. Should employers and schools mandate the COVID-19 vaccine? That's the question that we are trying to put some context around today in our presentation. We probably won't give you the yes or no answer to this by the end of the presentation, but hope to give you some of the legal background, some of the things you may want to consider, and maybe some other things that you may want to do instead of coming out and mandating the vaccine right away. Our agenda is we're going to talk about the current status of Connecticut, the workplaces and the schools in the state. We're going to then move on to vaccine and vaccination mandates. Then we're going to look at the collective bargaining obligations for those unionized workplaces. Also accommodations, requiring the proof of the vaccination, and then what happens if we have time, we'll talk about the employee and COVID-19 exposure. So what is the current status of COVID-19 in the state? Well, it is clear that the virus is in retreat, which is a great thing for all of us. This is from yesterday's press briefing from the governor. And if you saw the headline in today's Hartford Courant, you saw that there were 0 deaths reported yesterday related to COVID. And that's the first time since September 15th. And that's a great milestone to have. You can see the daily positivity rate is still below 1%, which is also great. But you can see the numbers are trending in the right direction. If you're a policy geek nerd like me, you've been watching the governor during this whole process. And this map was also really good to see yesterday. No red on the map at all. This is the first time in months that there hasn't been red on the map of the cities and towns. There's only 1 orange and fewer than 20 that are yellow. And that really also shows that the virus is in retreat within the state. All good news. You know, I work with a lot of school districts in the state, and I was talking to one this week. So it's a high school that's been open year round. The only time they've gone full remote is for snow days. And so I was talking to someone from that high school, and he told me that this week, for the first time all school year, they had 0 faculty and staff and 0 students out on quarantine all in one day. And that was the first time since the school reopened. And they were elated. It was a big announcement for the school, but you can see that we're heading in the right direction. But we're still in a pandemic, right? So we're still, employers, schools are being cautious, rightly so. And they're doing rolling reopenings, which we are seeing that are constantly changing. Bank of America, their locations, once they find out that 50% of their employees are vaccinated, then they'll reopen the locations. So some are open, some aren't. We heard from Travelers in mid-May that they were still capping the building capacity at 50%. To ensure appropriate social distancing. Every other workstation they were going to do, having employees still do the self-assessments every day. That may change. That was mid-May, right? That seems like eons ago, but that's what they came out publicly and said. State employees are back, all state employees. We know a lot of the public-facing state employees have been in. Some came in June 1st, but all state employees must return to the offices July 1st. Many employers are still requiring masks, especially in those common areas, right? So hallways, copy rooms, cafeterias, elevators, masks are still required because the pandemic still exists. And then under our own State Department of Public Health, some settings still require masks all the time. Schools, transportation services, healthcare. This morning, I was in a school building for a meeting at 8:30 and we were all wearing our masks. The pandemic still exists out there and people are rightly cautious. And then, very good timing for Keegan and I, last Friday, right before Memorial Day, the EEOC issued guidance saying that employers may require the vaccination before employees physically enter the workplace, subject to some accommodations, which we'll talk about. And then also they may offer these incentives for employees that are vaccinated. So I'll hand it over to you.
Great, thanks, Justin. So, like you mentioned, the timing of this ended up working out well. When we sort of had talked about doing this presentation several weeks ago, we really didn't know what things would look like today because it's been changing so quickly. When we first were talking about vaccination and this idea that employers might mandate the vaccine, this was back before we even knew that the vaccine was going to be available to everyone before the fall. So things have really changed, over the past month to 2 months in, how employers are trying to look at this issue and deal with it. So we do now have that helpful guidance that the EEOC put out on Friday. And before that, there was previous guidance that made it pretty clear that there wasn't going to be an issue, at least in terms of federal law, with mandating the vaccine in the workplace. But this more clearly states that that's the interpretation of the law, that employers, yes, they can mandate the vaccine if they choose to do so, if there's a business necessity for doing it. So really the question has moved away from that a little bit to, but should they do this? And there's a host of considerations that we're going to talk about today in making that determination. Just before I move on to that, there have been some questions that we continue to get regarding, how is this legal? There's been some legal challenges to the vaccine because it's still under this emergency use authorization as opposed to being fully approved by the FDA. And I think just a day or two ago, Moderna applied for full approval, Pfizer as well. So we actually expect that, to be coming fairly soon. So if you have concerns about that, one option would be to not mandate it now, but wait until that full approval, because we do think that will be coming, by the latest of the second half of this year. So just something to consider as we move forward. But looking at that, but should they question, it's really going to be this balancing test between employees' rights and having people comfortable in the workplace versus employers' need to make sure they're providing a safe workplace and how they can do that. So, considering all those issues, let's look at some of the practical considerations that you'll want to think about. And Justin, can you just jump to the next one? I'm not sure if it's there we go. Great. So practical considerations, I've just put a few of them here. This certainly isn't all of the things, you'll need to think about on this slide. One of the first things is to determine if you're going to make this decision to mandate the vaccine, are you going to do it for everyone or just certain individuals that are, always in the office or are working with, out in the field with customers or clients. So that's something to be thinking about, and how you do that in a way that doesn't necessarily discriminate against certain people, making sure you do it in an equitable fashion. If you mandate the vaccine, you want to consider whether you are prepared to take disciplinary action against employees who are refusing to do it if there's not a valid reason. And again, we're going to talk more about that in the accommodation sphere, but to determine what the policy is going to be about that and how you're going to handle it. Another big thing is how you'll actually administer the vaccine and what that program will look like. So would you have it, if you're a school, would you have it on site and have one day where you're having everyone vaccinated? Would you have people go to a third-party location, and be vaccinated on their own time, on PTO time? Those are all things that are going to go into how you implement this if you do decide to mandate it. We have seen that if you decide to do it on site, there's going to be some additional issues. I've put pre-screening questions here. So that's something to consider. It might be a bit more difficult to do this, on-site versus off-site, because screening questions could include disability related inquiries, which are going to lead to confidentiality issues under the ADA and other statutes, as well as may violate the ADA if you're going too far to ask for medical information and you can't justify, the business need for doing that. So it can be very tricky to go through these processes. And if you do decide to mandate it, we always say, reach out to legal counsel to make sure you're doing it properly, and through your human resources, just make sure you're looking at all those issues before you just decide to roll this out. And then again, just looking at what schools should consider. There's a number of issues here as well. So we have practical issues. Is the vaccine available? That's not as much of an issue now for people that are of age, but approval status for individuals that are under the age that the vaccine is eligible for will continue to be an issue. Are you requiring it for faculty and employees or just students? Again, are you prepared to exclude students from a school if they don't get the vaccine? How are you going to enforce this policy? So do you have language in your enrollment contract, handbook, or other policies that are going to put parents on notice that this is required for student enrollment? Will you differentiate between students that live on campus or day students, depending on the type of school? For international students, there are other types of vaccines, and I've been, recently reading about how employers in general are struggling with this, and are those vaccines going to work for the mandated policy, or will they not be, allowable? And how are you going to deal with that? Will you require vaccination prior to arrival for those international students or other students? And what is the process for requesting an exemption, which we think, we will certainly see be an issue as schools determine whether or not to mandate the vaccine? And then what accommodations would there be for exempt students? So those are, just an overview of all the things as a school that faculty, staff, teachers, students, the consideration of having those employers and the students mandate the vaccine. It's a lot of tricky issues. And one of the big things that's going to play into that is the collective bargaining considerations, which Justin is going to talk a bit more about. And Justin, feel free to chime in if there's something else you wanted to discuss here in the school context.
No, I'm good, thank you. Okay, so now going to move to the collective bargaining implications. So let's say you are in a unionized workplace. I think there are two main things you should be considering, right? Are you going to mandate the vaccines, or are you going to offer the vaccines and maybe do some type of incentive if you offer them? So if you're going to mandate them, you should look at, is mandating the vaccination a change in working conditions? Does it trigger a bargaining obligation? And the law is pretty clear. We'll talk about that. It does. And then what about if you're going to offer the vaccines to not mandate them? That could also trigger some collective bargaining obligation as well in unionized environments. So under the private sector, the collective bargaining obligations are part of the National Labor Relations Act, 8A5, which says it's illegal for an employer to refuse to bargain in good faith about wages, hours, and other terms and conditions of employment. And this seems to fit under those other terms and conditions of employment. There's not a direct case on point about this because it's new, right? COVID-19 is new, so there's not case law about this bargaining obligation. But if you look at the 1980 newspaper guild case, it says that any new requirement or rule that's enforceable through discipline or causes a change to employees' terms of employment is a mandatory subject to bargaining. And Keegan also said, and the things to consider earlier, are you going to discipline employees if about not getting the vaccine if they come to work? And if that's a yes, then there is trigger some bargaining obligation. So you have to think of how you're going to do this mandating, if there is discipline attached, or if it's new, then it could trigger this bargaining obligation under 8A5 of the National Labor Relations Act. But you might say, Justin, you said earlier, just a few minutes ago, we're in a pandemic, right? And doesn't that exclude anything? Well, in March of last year, March of 2020, the previous general counsel for the NLRB, Peter Robb, had issued a memo to all the regional directors about when there's not a duty to bargain in emergency situations. And what he outlined there is mostly these hurricanes, natural disasters. September 11th, there was a case on September 11th. It would seem to be hard to fit that a vaccine would fit under that emergency declaration, right? Because the first vaccine in the United States was administered outside of the trials in December of 2020. Here we're in June, so we have several months. We've seen the slow rollout on age groups. I really would find it hard pressed to think that that would fall under some emergency situation where you do not have an obligation to bargain if there's a union environment. So now you've decided, okay, maybe I do have an obligation. What do I do? Well, you should review if you have any review management's rights clauses, any zipper clauses in the contracts. Maybe there's something in the management's rights clause that allows the employer to go forward. Maybe it's so broad about health and safety that you could make the vaccine mandatory. Not sure, but those are two provisions of the contract you would want to look to. If you look at those or they're not in the contract and you think you have to bargain, then you should give proper notice to the union. Then the union can decide, are we going to demand a bargain? Are we going to just let the employer do what they want? Maybe because it's an incentive, we'll have a conversation. Maybe it's not official bargaining, but you should give proper notice to the union. At that point, you also then decide when you sit down with the union, the legal representative of the employees, are you bargaining over the decision to mandate the vaccine? Are you bargaining over the decision to have incentives for the vaccine, or just the impact? Or maybe even the decision to offer vaccines on site, or the impact. So you say, well, I don't know. I mean, we offer the flu shot, right? So isn't that fine? Well, it probably is, right? That you offer the flu shot, maybe the decision to offer the vaccine is okay, but there's still some impact, right? Who gets priority for the vaccine? Would you offer the booster shot? So let's say in 6 more months, you know, I had the Pfizer vaccine, I got it at work, and then Pfizer comes out and says in December, I need to get a booster shot. Is the employer then going to offer the booster shot as well? That is an impact. That's something you may have to discuss with the union and come to an agreement on. So that's why we really see a lot of employers prior to this EEOC guidance on Friday offering incentives, right? So United Airlines was really, that CEO was really clear early on that he was going to mandate the vaccine for his employees, because the travel industry, as we know, cruises, airlines and hotels were just clobbered over COVID-19. So I think some of that was him saying, okay, we're going to be safe. It's going to be safe to fly with United. Well, last month, just a couple weeks ago, he backed down, and instead he's going to offer incentives. He's not going to mandate it, but he's going to offer incentives through an agreement with the Airline Pilots Association. And any pilot that can show that he or she has been vaccinated would get 13 hours of added pay. And that's what we're starting to see. American Airlines is doing the same. They get an extra vacation day in 2022 if they show they were vaccinated, as well as some other $50 in internal rewards program that they have. We have Bridgestone Tires offering $100 support payment, and they have an agreement with their union, and it's not a cash payment, but it can use it for whatever you want. And they made it clear, use it for childcare if you need it to get the vaccine. If you need a transportation to get the vaccine, this $100 is so that you go and you get the vaccine. We see a lot of grocery stores doing it as well because they were frontline workers. Starbucks, 2 hours of paid time off. So the paid time off does come into play. It can be an incentive, but it can also become out of necessity because there may be effects of COVID the following day for work. And even in our own state, we saw the state employees and the CBAC, the State Employees Bargaining Agent Coalition, come to an agreement that anytime a state employee that's covered under their CBAC gets a shot, they get 1 hour of comp time. Now they can't roll over, it has to be used within 12 months, but there was an agreement between the bargaining agent and the state that they would get this comp time. And if employees took it during work, they could use sick time to go and get the vaccine. But that's what we saw here, even in our own backyard. There was an understanding through all these companies, United, the state, that they met with their bargaining agent and came to some type of agreement. So as I said earlier, what if you offer it to employees, but you don't mandate it? Well, I think it comes to mind also what I was talking about earlier, which is think about the impacts, right? Who's first in line? What if you run out? Do employees, can they just take time off? Is it comp time during work? And then that booster shot, which I've been reading in more and more articles, that's why employees are kind of shying away from it because they don't know what's going to happen maybe with a booster shot. So let's say you're in a unionized environment and you say, well, you know what, then I don't even want to deal with the union. I'm just going to offer it to the non-union employees. Can we do that? Well, if it's discriminatory in motive and you're saying, I'm not going to offer it to you, Justin, because you're a union member, that could be a problem. You could have a problem under the National Labor Relations Act because there's a discriminatory motive in how you're treating non-union employees versus union employees. So I would just say generally speaking, when you're thinking about mandating the vaccine, offering the vaccine, incentives for the vaccine, think about your ultimate goal. Is your ultimate goal to keep the workplace healthy and to keep it open? Then incentives may be the way you want to go, right? So I know when I was working with school districts, teachers were having trouble because they were early on getting the vaccine. Teachers are having trouble registering and getting the vaccine. So school districts got some clinics within the school districts to offer to teachers. And that was great because it was a way to keep schools open, to keep students in-person learning and all of that. However, school districts then found out that if they offered it to a group of teachers, a large majority of teachers on one day, there are side effects for some people with the vaccine. And a lot of those teachers were too ill to teach in person the next day. So then you have to think about it. Is the next day going to be a remote day? Do you offer it on a Friday and then it's the weekend where employees aren't working? Some schools preemptively, I know, closed completely, didn't even do remote for the day after the vaccine to allow teachers that they didn't have to have that burden of thinking, well, what if I do get sick and I don't have a lot of sick time? Maybe I'm a brand new teacher, or I just came back from maternity leave, or any of those issues, and I don't want to burn a sick day. So some school districts said, look, we're not even going to mess with it. We don't want you to think about it, but we don't want you to have to think about that concern of blowing through paid time off. So we're going to close down, and we're going to have a full remote day the next day. Those are all options you should consider, because it seems though many employers, their ultimate goal is to get shots in the arms, and that's what they're trying to do.
Thanks. So now we're just going to, switch gears a little bit. But before we do, I did just want to mention also with respect to this EEOC guidance that we've been talking about, and I've included the link here. So when we send this along later, you'll have access to it. It's been very helpful. And for purposes of non-unionized workplaces, it's pretty clear that the incentives that can be offered to employees to get the vaccine are not going to be an issue under the ADA, which had been a little bit of an unanswered question before that guidance came out. So I think that's helpful to know. Basically, as long as it's not something that can be seen as coercive, so it's not some benefit that's so great that it could be seen as they really have to get it. Then I don't think you have to worry about giving people, whether it be an extra day off, or we've seen gift cards or things of that nature are going to be allowable in terms of the ADA for encouraging your employees to go get vaccinated, especially if you're just determining I'm going to do this as a voluntary versus mandating, which I think a lot of employers are doing right now, and trying to see how that goes before they take the step to say, okay, we're going to mandate it, because the voluntary and the strong encouragement just hasn't been working. So when we look at the question of should we mandate the vaccine, we've mandated the vaccine. What happens if someone says, well, I'm not getting it, right? And that's when we need to look at accommodations. In general, if you have decided to mandate the vaccine and someone says, I'm not getting it just because I don't want it, you can discipline that employee and you can exclude them from the workplace up to and including termination. But there's a very large but there. And that is, you need to consider why they're saying they're not going to get it, and whether they might be eligible for an accommodation, either under the Americans with Disabilities Act or under Title VII of the Civil Rights Act, which we're just going to go through a bit here. Jumped a little too far, sorry about that. All right, so looking at the ADA analysis, many of you as employers are very likely already familiar with this interactive process. And under the ADA, of course, individuals are protected from discrimination based on disabilities. And to qualify for those protections, again, they have to be someone that has a qualified disability that with an accommodation can perform the essential functions, with or without an accommodation, with or without an accommodation can perform the essential functions of someone's job. And again, I didn't want to get too far into that here, because I know a lot of people are already familiar with that ADA requirement, but the part that can be a little confusing in determining is someone eligible for an accommodation under the ADA because they have a medical condition or a disability relating to being at risk coming into an unvaccinated workplace because of COVID and it's still existing, or because they can't get the vaccine because they have some underlying condition that prevents them from getting the vaccine. The considerations are going to be, once you've determined that they qualify, is there a direct threat to the individual's own health by them coming back into the workplace being unvaccinated, or is there a direct threat to other employees that are vaccinated? So things that you'll need to look at in determining that are conducting an individualized assessment. And I've listed here what goes into that. It's looking at the duration of the risk, the nature and severity of the potential harm, the likelihood that the potential harm will occur, and the imminence of the potential harm. So a very legalized way to look at what the breakdown is. In practice, you're going to essentially provide a reasonable accommodation to these individuals unless it's an undue hardship on your place of work, on the employer. And looking at what an undue hardship is, there's going to be a number of different things that go into that. And it may depend on what the workplace looks like. So do you have 95% of people that have gotten vaccinated and have voluntarily disclosed their vaccination status? Or do you have 40% of your workplace is vaccinated and you're concerned that this individual is going to cause a threat? And the things that you would have to do to get rid of that threat are going to cause an undue hardship because of cost, because of the safety risk and the nature of your workplace. Those are all things that are going to go into considering these issues and determining how you're going to deal with this. So those are just some of the things under the ADA, and I'm going to come back to that in a minute. But I also wanted to look at Title VII, which is protection for religious beliefs, among a number of other categories. But in the context of this analysis, we'd be looking at someone's sincerely held religious belief and someone who's objecting to getting the vaccine because of their religious belief. This is a tricky one, and we've gotten a lot of questions about this over the last several months. Title VII considerations, you need to look at whether someone's actually has this firmly and sincerely held belief. But then the question is, of course, well, how do you determine that? And what we say is that employers should ordinarily assume that an employee's request for religious accommodation is based on a sincerely held belief. It's sort of difficult to get into that challenge of saying, I don't believe you, you've never expressed this to me. You need basically an objective basis for questioning the belief before you go down that road. And under Title VII, you would need to provide someone a reasonable accommodation, again, absent that undue hardship. In this context, that hardship is more than a de minimis cost or burden. So it can't, for instance, just be because the employer is asked to stay home and work remotely as a reasonable accommodation, and you'd have to get them another monitor for their computer. That wouldn't be something that would likely be an undue hardship under this. And then in talking about the religious exemptions, the last couple times I did a presentation about this, we got a lot of questions about the recent Connecticut legislation that ends the religious exemption for mandatory school vaccinations. In this context, it doesn't really apply. At this point, that doesn't cover the COVID vaccine. I will say with the caveat, stay tuned. It's certainly possible that in the future that might apply. But as of right now, it's not something that gets rid of this religious exemption for individuals that don't want the vaccine because of this sincerely held religious belief. It also is applying to students as opposed to employers mandating the vaccine for their employees. So these are the two big things to consider when you're thinking, does someone have a valid objection to getting a vaccine if you're going to mandate it? And then looking at what are some of these accommodations that you can have for unvaccinated employees, again, assuming they qualify under either the ADA or Title VII for an accommodation. So some accommodations that are available would be requiring unvaccinated employees to continue to wear face masks, continuing to provide social distancing for unvaccinated employees from coworkers and non-employees, having some sort of modified shift so you didn't have the person in a highly populated office, periodic COVID-19 testing to make sure that individuals aren't continuing to test positive, an opportunity to work remotely, and even reassignment. I did add a note here. I just wanted to make sure to point out that in that recent EEOC guidance, the EEOC did note that employees who don't get the vaccine due to pregnancy, so they might decide that they're not comfortable getting it because they're pregnant, they may be entitled to similar type modifications, even though that might not be a qualified disability under the ADA. So something to consider there and to keep in mind. And then, we look at taking those two categories and putting them into the context of, can employees insist on continuing to work from home? And what about other accommodations? So, obviously during the pandemic, many employers, both schools and non-public type employers, shifted very quickly to a work from home model they might not have been prepared to do. but made great, improvements to that over the course of the last year in determining, how they were going to make that work. So it sort of changed the landscape on how we're considering this question. But the key points to point out here is that as a general matter, employers aren't required to provide remote work to employees who don't want to return to the office due to a generalized risk of COVID-19. So if someone doesn't qualify for an accommodation, or even if they do, and there's a different accommodation that would allow them to come back into the physical workplace and be protected, you don't have to just let them work from home. Employers, again, can discipline employees who refuse to return, but the question that we usually have as employers is, should we do this? So again, just looking at the ADA as a quick review, I know we just went through this, but it prohibits discrimination in all employment practices against qualified individuals with disabilities. So in determining whether someone can continue to work from home, you have to consider, does someone have the qualified disability? Would remote work allow them to perform the essential functions of that role? And does providing remote work cause an undue hardship to the employer? And the question that often comes up is, well, how can it cause an undue hardship if we let them do it all last year throughout the pandemic? And of course, it must allow them to do the essential functions of the role because they were doing it for a year. Well, fortunately, the EEOC also had given us some guidance on that and basically said, just because you have, and I'm going to jump ahead to that slide and come back, just because a workplace was remote during the pandemic, telework is not automatically a reasonable accommodation. So it's going to be this continual interactive process, something that you need to continue to look at. The essential functions of someone's job doesn't permanently change just because of the past year. So if you had, for instance, teachers teaching classes from their homes over Zoom because of the situation, during the pandemic, that doesn't mean that allowing a teacher to teach from home is always going to be a reasonable accommodation under the law. They might be eligible for some other type of accommodation if coming in is going to pose a risk because of an underlying health condition that prevents them from being vaccinated. But that's that process you're going to have to go through with the employee. So just important, because we get this question a lot. And remote work during the pandemic will be a factor in whether the employee can perform the essential functions remotely. So it will be a factor, but it's not going to be, the sole deciding factor. Other things to consider as you're, going through this analysis is how objections to the vaccination affect the ADA analysis. So in other words, if someone says, well, I can get the vaccine, but I'm not going to get it, is the employer now in a position where they can say, well, we're not going to provide you any type of accommodation for your disability? And that's not the case. It doesn't affect how we do this analysis. You still need to go through the process, even if someone's refusing to be vaccinated. So that's an important thing to remember. And we want to make sure you're not, running afoul of any of the requirements there. It's also important to remember that it's unlawful to disclose an employee's reasonable accommodation or to retaliate against an employee for requesting this type of accommodation. So even if an employee asks to continue to work from home, to work remotely, and you determine that that's not going to be a reasonable accommodation, you can't retaliate against them just for asking. You have to, again, go through that process. So just to jump back here for a minute, looking at all of these things, how should employers handle requests to work from home and other accommodations? So, what should you do when you get employees coming to you and saying, I don't want to get the vaccine and I want to continue working from home? So you need to train your managers and supervisors to recognize an accommodation request. It's not very likely that any employee is going to come to you and say, well, I don't want to, come back to work because I demand a reasonable accommodation under the Americans with Disabilities Act. That's not how they're going to do it, right? So you need to train managers and supervisors to understand that someone's saying, I can't get this because I have a religious objection or because I have this medical condition, I'm immunocompromised or something. That's going to trigger some of these obligations, and they should know, okay, I'll take that to HR, whoever the appropriate person is to deal with that. Again, just to engage in this flexible interactive process, you might look at other resources like consulting the Job Network, JAN, and OSHA COVID-specific resources that provide some information on things you can do to have these accommodations. You can rely on the continued CDC guidance, which continues to change. So, if it changes in the future and says masks aren't required for anyone, because we now know that with X percentage of vaccinated people, non-vaccinated people are not at risk. You can look to that guidance. So, be up to date on what that is. And you may ask to get obtaining supporting medical documentation from employees that are requesting these things, making sure you are careful not to go too far afoul of the disability related inquiries if you're not required to do so for that business necessity. And then just as a last point, consider all options before denying the request. So before you just tell someone, they cannot work from home or they cannot have some other type of accommodation, you need to consider the context of the workplace. So again, the proportion of vaccinated employees and the extensive employee contact with non-employees in the workplace, which can all impact this consideration of whether it's an undue hardship and whether there's a direct threat to the employee and other employees in the workplace. We'll just jump back ahead here. So now I'm going to turn it back over to Justin to discuss this issue of, can employers require a proof of vaccination?
Great, thank you. So can the employers require you to show that you've been vaccinated? So the EEOC guidance says that employers can, so they can ask, and we see more and more employers doing that. Even in the non-employer circumstance, for example, my gym, it's not one of those big chain gyms of Planet Fitness or anything. It's a small gym. And the owner said, if you want to work out maskless, without a mask, we have a limited number of people in our classes, you have to submit proof of your vaccination. And if you don't, that's fine, but you have to continue to wear a mask. So back to the employer, now we see more employers asking this question, can they? Yes, they can ask for proof of vaccination and whether an employee has been vaccinated. But there are some ADA considerations, which is be cautious about follow-up questions. The question of why aren't you vaccinated should not be asked because it may elicit some information you don't want to hear. The questions and the information in the follow-up should be consistent with the business necessity. Should warn employees not to provide medical or genetic information. And employers should also understand that they need to store the vaccine-related information in a confidential file. Taking all that into consideration, should employers ask? Well, that's something you're going to have to decide yourself. But why would you be asking the information? As Keegan was just talking about, there is part of this analysis is how many people in the workplace are vaccinated. That will come into play. So when Bank of America says we're only opening the offices when 50% of the staff say they've been vaccinated or more, that's what they're using it for. So consider why you're asking. Consider who the ask is coming from. So is it someone in human resources that employees would trust the information with? Or maybe it's a frontline manager that employees tend to be leery of. Maybe it's a frontline manager who has loose lips, right? So, I personally have worked with this in a school district that asked employees to show proof of their vaccination. And at first, educators were, why would we have to show this? Because they were concerned about the third bullet point. They were concerned that they would not be told if a student in their classroom was positive for COVID or part of the contact tracing. Because maybe not everyone in their home, the teacher's home, had been vaccinated. Maybe they aren't able to be vaccinated because of other health conditions or aren't eligible for the vaccine because of age. So the employer, the school district at that point said, no, we will tell you under normal contact tracing, but we're using this to keep our schools open longer, to have more in-person learning. And so it really put teachers at ease. It also put teachers at ease to know that it was going to be stored, this information, at the central human resource offices, not in a principal's desk where other people may have access to it. So these are all things that you should consider if you're going to ask employees if they've been vaccinated. A lot of employees are cautious. They have medical information, they'll cite HIPAA right away. They can ask. That's the number one question. But the way you do it, it's all about that. And so actually in the school district we worked with, we even had after discussions with the union, the HR director did a video because it was just more soothing and calming, and it made employees feel more at ease, like, okay, now I understand why they're asking for this information. And they had a great rate of return of teachers showing that they were vaccinated. And hopefully that helps them down the road to keep the schools open.
So just before we jump to this next question, on that same topic of can we ask for the proof of vaccination, I think one thing that was interesting that I saw from reviewing all of that new guidance on Friday and trying to get up to speed so that we could advise everyone on it. One of the interesting things is that basically, in addition to asking for proof of a vaccine, you can give someone an incentive, according to the EOC, to give you that proof of vaccination. So again, as long as it's not coercive, that you can request documentation or some other type of confirmation if they don't feel comfortable, sharing the vaccine card that they got at the vaccination site, because that's not a disability related inquiry that's covered by the ADA. And I think there was, still a little bit of question about that until we got some of this guidance. So it's helpful to have that and know that you can actually give an incentive. So if you're asking employees to voluntarily come forward and share their proof of vaccination, there can be something that you're giving them to do that. And of course, the impact of that might have implications under your collective bargaining agreements. That's a sort of that separate issue, but just in general, employers can decide, I'm going to give employees an extra day off if they tell me, that they've been vaccinated or they have, what their vaccination status is. The thing to be careful of about that is, of course, if someone can't get vaccinated, you don't want to be discriminating against people by giving people that cannot get vaccinated a lesser benefit than people that can, but asking that status question and for them to provide the answer, that's something you can incentivize. So I think that would be helpful going forward for those that are trying to follow this voluntary process versus mandating at this point in time. So just something to keep in mind.
So Keegan, you mean an incentive beyond the sticker we all got when we got
I liked my sticker and I shared it, but yes, so something that, your actual employer would be giving you, I'm not sure the sticker would be enough to get people to voluntarily disclose to their employer their vaccine status, but, you could try that and see if you get anywhere. So just then turning to this last point here is, now we're in a workplace and we have one of our employees that has been exposed to COVID-19. Now what? And looking at this question, I think is different than when we had this question in March of 2020, right? It's sort of a very different context of, well, we immediately need to shut down, send everyone home. That's not really, I think, what we're looking at going forward in this new context of vaccinations. Just trying to jump to the next slide here. There we go. So the question is the employee vaccinated when you have this exposure in the workplace? If someone is fully vaccinated, the CDC has said if there's no COVID-like symptoms, they actually don't need to quarantine or be tested as you would previously have done for any employee that even just showed any types of symptoms. If the person does have COVID-like symptoms, even if they're vaccinated, they should still get tested, stay home, and stay away from others. And if the person isn't vaccinated, it's basically going to just be a continuation of what you've already been doing, over the past year, and excluding that person, trying to figure out who they've been in contact with. All the things that you've already been doing, would apply to someone that's not vaccinated. Again, this shows the importance of knowing whether people are vaccinated or not, and trying to do that contract tracing, whether it's through voluntary surveys, incentives, and other things. And you also want to review the steps in response to exposure. So is it a workplace or a non-workplace exposure? Was the person on vacation? Were they somewhere internationally, and you think it was there? Or do you think there's an outbreak like, on the Yankees, that all 6 people now have it, even though they've been vaccinated? So that will be, something you can try to figure out. Consider any applicable contract and collective bargaining agreements in reviewing if there are certain steps that you need to take now in response to exposure. Providing COVID-19 testing at your expense, whether that's on site or just off site. I think that's something that's become much easier to do now as it's more readily available. Determine whether you need someone to quarantine as well as other people they've been in contact with, whether they can work remotely without sort of a break in doing their jobs instead of having to take time off. And then consider what the leave options might be. So if the person has, paid time off, if you're going to make them use that for this situation, if they don't, whether you just, have the person use sick time, go home anyways. And then there's the American Rescue Plan Act as well, which some employers, it's basically the continuation of that FFRCRA leave that some employers have opted to continue, and they can take a tax credit for. That's been completely voluntary. So that's not something that, all employers have chosen to continue, but you could look at, a leave option under that as well, and whether that's something you want to offer to employees. And then, of course, there's the legal considerations in determining how to respond to exposure. And that's, again, confidentiality. So if someone's been exposed, someone has COVID, certainly, don't want to be emailing everyone to out the individual. You can tell people on a need to know basis, and you can, usually keep the identity of that individual confidential if possible to, do that and still inform others that they may have been exposed. Being careful about discrimination and retaliation in this context and treating people equally. If they've been unvaccinated because of a disability, again, you can't just sort of discriminate against them and say, well, they chose not to get vaccinated, and retaliating against those individuals. You also want to look at OSHA's standards that might apply to protecting workers from infection. Those remain in place. They continue to be updated. Workers who are vaccinated, even though they've received the vaccine, must continue to follow these protective measures. We also had gotten a lot of questions about workers' compensation coverage. We did have an order by Governor Lamont in Connecticut that basically said workers' compensation will be extended to essential workers who contracted COVID-19 between the dates of March 10th, 2020 and May 20th, 2020. So basically assuming that it was, happening in the workplace as opposed to outside of work. But that so far has not been extended beyond that time period. So, at this point, it's unlikely that workers' compensation coverage besides that time period would apply for individuals that are exposed at work. So just, something you'll want to contact your carriers about, but that probably won't be applicable here. So just all the different things, to consider if this unfortunate situation happens where, you have someone that's either been exposed or test positive in your workplace. And then we just have some takeaways here. Justin, did you want to go through these? Oh,
Sure. Yeah, sure. We can do them quickly. I mean, I think what you've heard is the theme here is stay tuned, right? Keegan and I both said it. Things are changing and evolving, but the takeaways are the employers can mandate the COVID-19 vaccine, but you should consider, the practical issues. Look, if you're a unionized workplace, first look at the collective bargaining agreement and then the impact of mandating such a vaccine. And then think about the reasonable accommodations. Employees may be eligible for reasonable accommodations that exempt them from the vaccine and or returning to the office. And so when you're asking about the vaccination status, be careful not to ask for any follow-up or what follow-ups you do ask and get additional medical information or information that you don't want. And then, as we said, the stay tuned. We'll continue to monitor, employers should continue to monitor all the federal guidelines, CDC, OSHA, EEOC guidance regarding COVID-19 and vaccinations.
Guys, this was amazing. It seems like, this is just such an area where there are so many complexities to navigating what to do and all of the different issues around, as you're saying, unionized workforce, OSHA standards, workers' comp, accommodations. I could imagine, years from now, this being one of those like issue spotting questions on some law school exams. So, but we do have some questions that I want to get to. So one is, let me see. If a hospital or nursing home already requires employees to get the flu shot unless medically exempt, does that make the COVID vaccine easier to do unilaterally? So if they already have a mandatory flu vaccine program in place, does that minimize or change in any way their requirement to bargain over implementing a mandatory COVID vaccine? I think one of you touched on this a little bit, Justin.
Yeah, I mean, I think there still could be the obligation. So if it was covered, the flu vaccine was covered under the normal operating and the collective bargaining agreement, that would definitely make it easier, but there's still some of this impact, right? So if you're going to offer it, then are you going to offer the booster shot? But does it make it easier to mandate? Well, then you have to take into account this emergency declaration that they allow. This is a different type of vaccine, right? So as Keegan was talking about, when a lot of people ask about the state law and that one, it only pertains to schools with mandatory vaccinations, but it also doesn't touch at all COVID. That may change though, if it gets beyond that emergency approval. So I do think it does allow the employer, if they already have that in place, it'll probably make it easier down the road, but there are still some things they should consider right now.
Yeah, I completely agree, Justin. I mean, I think once it's fully approved, that will be more helpful because, it'll be more similar then to the flu vaccine than it is right now, where we have this sort of unprecedented EUA in place. And there's this question of different vaccines and which one, and, the booster shots, it's a lot to consider. But also in terms of just implementing it, if someone already has that set up, that part of it will likely be easier because as a practical matter, they'll have already dealt with some of these issues about how to deal with, pre-screening questions and things like that. So just from the practical standpoint, that might be helpful in that sense.
Yeah, thank you. We do have another question regarding the ADA process. If an employer mandates the vaccine and the employee declines, would they be entitled to the ADA process if their reason was not related to an underlying medical condition? So, yeah.
Yeah, so in order to qualify for a reasonable accommodation under the ADA, you'd have to have a qualified disability, and certain medical conditions might meet that standard, some might not. That's going to be the process you have to go through with getting their information about what it is, and them filling out the appropriate paperwork and getting a certification from their doctor to determine what that is. The confusing thing about during COVID has been, well, what if someone is not quote unquote disabled? They don't have something that prevents them from doing the essential functions of their job, but they do have something that makes them at a higher risk for COVID. That might qualify for an exemption under these policies. It's really going to be looking at what it is and what the risk is, and it might depend on how many other individuals in your workplace are vaccinated, so what the risk is. So that's all going to go into part of the determination. I thought the EEOC's guidance on pregnancy was particularly helpful because, like I said, depending on when someone is in their pregnancy, that might not qualify the entire 9 months as a qualified disability, but they might be eligible for an exemption from the vaccine. So it's just something you're going to have to look at on a very fact-specific basis. And really the onus is on the employee to come forward and say they need this. It's not as if the employer who's mandating the vaccine has an obligation to just individually go to each employee and say, if you think you can't take it, do X, Y, Z. It's a two-way street. So there needs to be that interactive process.
Yeah, great. I know we're getting to the top of the hour. We have one other question here, a few more actually. If an employer or school requires the vaccine, does that mean that they will also be allowed to require boosters? If it's determined, which we've been hearing about, and Justin, I think you referenced this, that maybe 6 months or a year from now, everyone will need a booster. Can they mandate that as well?
Yeah, I mean, I think that's going to be a question, right? So what does the booster look like? Is it going to be just recommended, or is it something that they think everyone needs to keep up the 90% or whatever, the 95%? So I think that is something that employers should consider and schools should consider because that may come down the road, but we don't have them yet. So I don't think there's an answer to that, but it is something that I think will have to come into play for employers and employees, especially in the school setting, which we know that's kind of one of the first places where the vaccines were available in a workplace setting, so that we wanted this in-person learning to take place.
Yeah, I mean, I think in the sort of, especially in the non-union context, I think it's going to be pretty clear that employers will be able to say, yes, I'm mandating the vaccine and you have to get the booster, but with the caveat that assuming it's, proven to be as this at the same level of sort of safety and not have side effects and all of those things, which we really just don't know yet, I think, until we see what it's going to look like.
Great. And we'll just take, we have a couple of questions. You guys good for like 2 more questions?
Oh, sure.
Sure.
Okay. If an employee refuses to work with another employee because the first employee claims that the other person has a religious exemption, what to do? So we have
So meaning because they basically, employee A doesn't get the vaccine and employee B doesn't want to work with employee A now.
right.
Right. I mean, I think that's, a difficult thing you're going to have to deal with because it's what you can do and what you maybe should do to make sure that your workplace is a place where people are able to come in and be productive and, have morale that is not just, tanking among your employees. I think as a practical matter, you can, say you have to come in and work with that individual. You can put in some precautions like the social distancing and the masks, but really we've been able to do that, for some time now to have people come back to work and be unvaccinated. So, you can tell that person that, sorry, you're just going to have to work with this other individual. But, as a practical matter, you might want to consider, is that employee the only one that has the complaints? And maybe we want to make some sort of accommodation. I shouldn't use the word accommodation because that's a buzzword. Maybe you want to make some alternate arrangement so that individual can work separately in an office, farther away from other people, or maybe they can work remotely if they're able to do all the essential parts of their job from home. But Justin, do you have any thoughts on that one?
Well, I would just also say, we're in Connecticut, so the Department of Public Health is still requiring employees to wear a mask
Right.
if they're unvaccinated or the vaccination status is unknown. So it's not like maybe some of the southern states that don't have a mask mandate. We still have it. It may not put the employee at ease, but they could, that definitely comes into play.
I mean, I think communicating with employees is going to be key, whatever, you determine the policies are going to be. So, especially if you have this situation and that 90% of your workplace is vaccinated, that might allay some fears about the handful of individuals that are not, vaccinated for whatever the reason may be.
Yeah, great. And then one thing that I don't think we've touched on yet is whether an employer can be liable if they've mandated the vaccine and somebody has an adverse reaction to it. And we may not have the answer to that yet.
Yeah, I don't have the answer. Keegan, do you?
Yeah, so that's been something that has come up a bit. I think, again, it might be something that would fall depending on if it happened during working hours, whether it was an injury that happened at work. It could be considered a workers' comp sort of issue, whether there would be some sort of liability there. I think potentially there could be some liability, but I will say I don't think it's enough of a risk to keep employers from mandating it if they think that's what they need to do to keep the workplace safe. I think the greater issue will come from, not mandating it in a case where you have, for whatever reason, your workplace has decided not to do it, and that the majority of people are choosing not to be vaccinated. Again, I think in Connecticut, that's not as much of an issue as maybe in some other states where that will likely happen. But the bigger issue, I think, is in those situations where that not everyone's getting it, you decide not to mandate it and make people come back, and people continue to get sick, and there may be some OSHA violations and how the workplace is being conducted. So there might be some small risk of liability. I can't say 100% that there wouldn't be. Again, another reason to have it administered offsite as opposed to running it yourself, because I think that really minimizes some of it. But I know that's going to continue to be a question going forward. I don't think it should discourage people from making the decision to mandate if they think that's necessary to keep their workplace safe.
Yeah.
It may go to that reason to incentivize, though, as well.
Right. Correct.
Yeah, I think the next couple of months are certainly going to be interesting. You know, I've read a lot of things where there's a lot of vaccine hesitancy insofar as people are just waiting for the FDA approval, so it's not being just used under the emergency use authorization. And then when that happens, will you see more employers now requiring it? And will you see more employees actually getting vaccinated? It will, those two things will certainly work in parallel together. And hopefully we will be in a much better place as time progresses as well.
Yeah, I mean, I will say, I think the majority so far we've seen have been trying the voluntary, strongly encouraged incentives first, especially, until that full approval is here. And, I think we're in a better position in our state than in some other states where that will, for a large number of employers, be sufficient, in an office setting and things like that, where I think it's going to be more of a question on whether we really need to mandate it is in the employment context of manufacturers or people that are dealing with customers every day. Those types of workplaces, I think, are going to be a little bit of a different evaluation on whether they mandate or not.
And healthcare providers.
Exactly. Sure.
Right. Well, I think we could talk about this all day, again, because of the multiple and challenging issues that this pandemic and the vaccine have brought forward. But you guys have done an outstanding job. I know, Keegan, you said that you would make the slides available. So I will push that out to everyone with your CLE certificates. I want to thank both of you so much for all of the time that you put into preparing for this presentation and your time today. And I just wish everyone on the call a happy and healthy summer. This wraps up our program year. And just thank you again for supporting the Labor and Employment Relations Association. And check your emails over the summer for the programs for next year. So with that, we'll end the program. And thank you again so much for attending and for presenting today, Keegan and Justin. Take care
Great.
now.
Thanks for having us.
Of
Thanks.
course. Bye.